So, according to the National Institute on Alcohol Abuse and Alcoholism, there are a few ways that alcohol can actually affect your body. So, let's start with the heart. Some heavy drinkers can develop heart trouble because alcohol actually weakens the muscles in and around the heart, and that's going to result in the heart not pumping enough blood to nourish other organs in the body. Also, heavy drinking can constrict those blood vessels or make it tighter, and that's going to cause high blood pressure. And high blood pressure will kill you. It will cause a stroke, which is what happened to my friend. High blood pressure. She had a stroke. Her partner actually had high blood pressure and passed away about a year and a half ago. And he died of renal failure because of the unchecked high blood pressure. So it can affect you very young, very young. They were mid-30s, and high blood pressure will kill you. And it is actually a common problem in African American males. So if you are African American and you are a male, I would highly recommend having your blood pressure monitored. And if you need to take blood pressure medications, please make sure that you do, because it can kill you very young. You don't have to wait until your 60s. In your 30s, it will take you out. Some other potential consequences of heavy alcohol use are irregular or fast heartbeats, heart disease, and an increased risk for some kinds of stroke. And if you don't know what a stroke is, it's where there's two types of strokes. One is where a blood clot comes to your brain, and because the blood vessels in your brain get smaller and smaller as they go up, the blood clot may have been freely able to move through the other blood vessels throughout your body, but when it gets to the brain, it can't go anywhere because the vessel is so small that it will block the flow of blood. Other types of stroke is where you have the blood vessel bursts and it bleeds into your brain. And so you're losing oxygen to that portion of the brain. And if so, depending on where the blood clot or the bleed is what is going to get damaged in your brain. And so if there's no oxygen, no blood flow to that section of the brain, then all those brain cells start to die, and you lose the ability to function in that particular area. So some people it's their eyesight, some people it's motor coordination, some people it's their personality, their ability to cognitively function, some people it's speech and language. It just kind of depends on what part of the brain was affected and how long you were without oxygen, because eventually all of those sections of the brain, if left untreated, will start to die off, and you will become brain dead. And if they find you, you will just be a vegetable at that point. I had a funeral 3 weeks ago where the guy had a stroke, and no one found him for 5 hours, and he was completely brain dead. So lack of oxygen does cause severe problems. So moving on to the brain, talking about how alcohol actually affects that. It actually speeds up the normal aging or causes premature aging of the brain. And so research shows that there is shrinkage of that frontal lobe, and that's going to increase with chronic drinking for both moderate and heavy drinkers. So if you only drink moderately, but you drink chronically, this can actually shrink that frontal lobe. And so the frontal lobe is actually, this is our prefrontal cortex in the front part, and that is our rational decision-making part of our brain. And that part of our brain isn't really fully developed until we're about 25. If you look here, the brain develops from the cerebellum, and it comes up like this, and it fully develops to the front. So it's starting developing from the back and moving front to the front. So when you're a baby, you can't really see, and you have a hard time focusing. You don't see colors and things like that when you're born. And then after a couple of weeks, you're able to see like the primary colors, red, yellow, blue, and you're able to start focusing a little more. So if you've ever seen a baby, they have a hard time controlling their eyes. They have like roaming eyes, and once they get a little bit older, they're starting to be able to focus on a particular object like mom or dad's face. Things start to become in focus that are close to their face, and then eventually that occipital lobe is developed, and after a couple months they're able to see the colors and focus on things, get control of their eyes. And then we start to learn language and movement and things. And so that's going to be up here. And as these things are developing, we're able to do more things. And so once we get into this frontal lobe, this is like our ability to think rationally, right? And so we're getting into like middle school, high school, and then eventually this is fully formed when you're about 25. And so this portion of our brain is responsible for the rational decisions that we're making. And so obviously, if it's not fully formed, when we're teenagers, we make some dumb decisions. Y'all, but I made some pretty dumb decisions when I was a teenager, all the way up until I was about 25. So we've spent 25 years developing this portion of our brain, and now we're drinking and we're actually shrinking it up or aging it even faster. And that can cause a lot of problems as far as your ability to make rational decisions. And you're shrinking it. Another thing that actually happens is, this is related to intellectual impairment in both older and younger drinkers, and it affects learning and memory as well. But one thing that happens with chronic heavy abuse of alcohol is, some people call it wet brain, but it's called Wernicke-Korsakoff syndrome. It's not two different syndromes, Wernicke's and Korsakoff's. Korsakoff is an advanced stage of Wernicke. So it's kind of like dementia almost. And it is often mistaken for dementia if the patient's drinking history isn't disclosed to the doctor. The doctor could misdiagnose with dementia here. But you lose the ability to function, really. And you're slowly shrinking your brain down to not being able to function, not being able to remember who you are, how to eat, how to get dressed, anything about your life. You just kind of slowly slip away. But you're doing that to your own brain. So it is called Wernicke's encephalitis, which, if not treated, then turns into Korsakoff syndrome. And Korsakoff is an amnesic syndrome, which, like I said, it's not different conditions, but just different stages of the same disease. And it's caused by a lack of thiamine, which is vitamin B1, which is what happens when you are drinking. Alcohol does lead to an increased risk of cancer. Long-term heavy drinking increases the risk of developing several different types of cancers. And that's because the alcohol actually does weaken the body's immune system. So it's going to reduce its ability to fight diseases and infections. And some forms of cancer are especially common in heavy drinkers, like cancer of the esophagus, the mouth, the throat, the voice box. And there is liver cancer, bowel cancer, anything to do with the digestive system basically could get cancer. And women who have 2 or more drinks a day are at greater risk of developing breast cancer. And interestingly enough, just a side fact here, if you've had breast cancer and you've beat it, if you eat eggs as a regular part of your diet, you're actually at an increased risk for it coming back. I don't know why eggs increase the risk of breast cancer coming back, but they do. Yeah. Other cancers that may be related to heavy drinking are going to be cancer of the colon and the rectum, the liver, the bowel, the esophagus, larynx, things like that, wherever it goes down. Speaking of the digestive system, Heavy drinkers are more prone to excessive heartburn, ulcers, and even bleeding into the digestive system. And they can suffer from illnesses that are caused by an injured pancreas as well. So the pancreas is actually what helps to regulate the amount of blood sugar by making the insulin. And the gallbladder too. We found that the gallbladder does have a role in insulin production, which is interesting because we thought that the gallbladder didn't do anything before, but now we're understanding more about what the gallbladder does. And so when there is heavy drinking, the pancreas then becomes inflamed and it becomes extremely painful, and we call this pancreatitis. And that can cause diabetes or even death. And the symptoms of the pancreatitis are severe abdominal pain and excessive weight loss. So there's two ways that the glucose actually can interfere. So the glucose is the energy for our organs. And so when we eat, the food is broken down into glucose, and then we have the glucose kind of free floating into our system, our bloodstream. So if you prick your finger, then you have you can get your blood sugar level, and that's just telling you how much glucose is kind of free floating in your bloodstream. But if it's in our bloodstream, then it's not getting to the organs, obviously. So there can be two reasons why this is happening. Either we have a high blood glucose level, which means that we're not producing enough insulin to get the glucose to the red blood cells so that it can go where it needs to go. Or we can have a low blood sugar level, which means that we don't have enough glucose in our system. So either we haven't eaten to produce more glucose, or we've overproduced insulin and it's used up all of our stores of glucose, and now there's not enough insulin to get the glucose to where it needs to go. So those are two. One is hypoglycemic and one is hyperglycemic. Hypoglycemic is I don't have enough glucose in my system at all. Either I haven't eaten to produce glucose, or I've overproduced insulin and used up too much of it. Or the other one is hyperglycemic, and I have way too much glucose in my system and not enough insulin to get it to where it needs to go. Both are dangerous situations. Hyperglycemia actually is a longer-term damaging thing, and this is what people with diabetes type 2 have to deal with, hyperglycemia. And then hypoglycemia is where my blood sugar is too low. Now, this is a life-threatening emergency if you're in hypoglycemia. I actually had gestational diabetes, and I took, when I was pregnant, I had gestational diabetes, and they gave me insulin, and I took the insulin in the morning, and I ate my breakfast, and everything was fine. And then right before lunch, I decided to lay down and take a nap. I was really tired, and that should have been my first warning sign that I was so tired that I needed to lay down and take a nap, because I don't take naps. So I laid down, I took a nap, and I don't know what force in the universe decided to wake me up, but it did. And I couldn't see. I was completely blind. I was drenched in sweat, and I was shaking really bad. I had to call one of my kids to come test my blood sugar. And just so you know, like, the danger zone is like below a 60 for pregnant women. I was at a 17. So I should have been dead at that point. I should have been either in a coma or dead at that point. So if you're ever in a low blood sugar type of situation, it is life-threatening, it is dangerous, and you can drink 15 ounces of orange juice at a time, wait a few minutes, and then check your blood sugar, and once it gets back up to whatever it's supposed to be, I think it's like 80 for a normal person, 60 for a pregnant woman. Once it gets over that, then you can eat something, but don't eat anything until you get your blood sugar back up. You can drink 15 ounces of orange juice, 15 ounces of soda. They have glucose packets that you can take. It's like a liquid form of glucose. You want something that's easily digested to bring your blood sugar back up. The reason I'm telling you this is because drinking alcohol actually does interfere with the sugar processing and the hormones that regulate your sugar levels. So chronic heavy drinkers often have very low level of healthy blood sugar, which is your glucose, because they go without eating proper food while they're drinking. So their stores of the healthy sugar are exhausted in just a few hours. And also, the body's monitoring of sugar can be affected while the alcohol is being digested. And so the combination of those effects can cause severely low levels of blood sugar, which is hypoglycemia, anywhere from 6 to 36 hours after a binge drinking episode. And I think a binge episode is it's either 4 or 5 drinks in any one given setting. And this is standard drinks. So if you have like 2 tall boys, that's a binge drinking session. And failure to treat this condition can be life-threatening. You could pass away. Now, with the reproductive system, for males, according to the Montana State University, alcohol can actually affect the male reproductive system by causing reduced testosterone levels. And so prolonged use actually causes the testes to shrink, which can result in infertility, impotence, like you can't get it up, feminization of the male sexual characteristics. Examples of this are like breast enlargement, reduced chest and facial hair, and a shift in the fat distribution to the hips from the abdomen. And it also affects how the hormones are released from the pituitary and the hypothalamus glands. So that causes problems with the male reproductive and sexual functioning. And then for females, the chronic drinking can also have a variety of problems in their reproductive system. So West Virginia University stated that abnormal menstrual cycles and a failure to ovulate are 2 of the main effects of alcohol on women. Others include an increased risk in spontaneous abortion and also early menopause. And the incidence of breast cancer is also higher in women who consume alcohol. And women, like men, have a higher risk of contracting an STD while under the influence of alcohol because it lowers our inhibitions from the alcohol consumption, and it often leads to unprotected casual sexual encounters. Inhibitions, in case you don't know what that word means, an inhibition is if I say I'm inhibited from doing something, it means that I've stopped myself from doing something. So I don't my ability to stop myself from doing stupid things like sleeping with random people at the club is significantly lowered when I'm inebriated or when you're inebriated. And so we have a risk of developing STDs because we might have unprotected sex with somebody. Or you may end up with a child. One of the 2. Now let's talk about the liver. The liver is like a filter, right? If you have a sponge in your kitchen, you run water through it. It's like a filter, right? And the liver is responsible for removing alcohol and other harmful substances from the body. But drinking more alcohol than the liver can break down usually results in a buildup of excess fat inside that liver. So I don't know how many of y'all have had the misfortune of accidentally pouring grease down the drain. What happens? It clogs the drain, yeah. So it's clogging the drain. So it's the same thing. If you've ever cleaned something that had grease on it with that sponge, can you use that sponge anymore? No, you can't use that sponge anymore. That sponge now has grease all clogging its pores, right? And that's the same thing that's happening inside the liver is that excess fat buildup is clogging those pores and it's making it unable to filter anything. And we don't really have the ability to go in there and like pour hot water on it. So if you're having excess fat in the liver, you're not going to be able to process that out. And when I said when we drink more alcohol than the liver can process or that it can break down, It's 1 standard drink per hour. So 12 ounces of beer per hour, 5 to 6 ounces of wine per hour, 1.5 ounces of liquor per hour. That's what the liver can process out. So if we're drinking more than that, then what's happening is that excess is just kind of floating around in our bloodstream. And that is how we get a blood alcohol content of XYZ amount of alcohol, because this is how much is just free floating in our blood until the liver can process it out. So if you drink 2 drinks at the very beginning, the liver is able to process out 1 of those drinks in an hour. So the second drink will be fully processed out after 2 hours. So just keep that in mind when you are drinking, that if I'm going to get behind the wheel of the car, for every 1 drink, it takes 1 hour to process it out of my liver. All right. And so when we have that excess fat in the liver, it does lead to alcohol hepatitis, or an inflammation of the liver. You can give yourself hepatitis. It's not something that you contract, right? And that's as a result of heavy drinking. Symptoms of hepatitis are going to include fever, yellowing of the skin and the eyeballs and the urine, which we call jaundice, and pain in the abdomen. And although this condition can cause death if alcohol consumption continues, the process can be reversed. Just like we can lose fat if we exercise and eat healthy, same thing, if you start eating healthy and exercising, we're going to lose that excess fat in the liver as well. Now, what's not able to be reversed is cirrhosis. And 10 to 20% of all heavy drinkers actually do develop cirrhosis of the liver. This is actually scarring of the liver. And I don't know if any of y'all have a scar on your body, but those things don't tend to go away, right? They're there. And even if they do fade over time, it's going to take years and years and years just for them to fade, but they're still there. So imagine if we took our air filter or our sponge and we start making rips in it. It's not going to be able to function the way that it's supposed to anymore. That is what hepatitis is. You're scarring the interior of your liver. And if you ever had a scar on your head or on your arm, no hair grows there. And so if we scar the tissue, the filter tissue, it's going to create that scar mark and not be able to filter through that anymore. So in contrast to the hepatitis, it's not possible to reverse the damage done to the liver by cirrhosis. Although the symptoms can be relieved and liver functioning improved by abstaining from the alcohol, it's just not reversible. There is treatment for some of the complications that are caused by cirrhosis, and the last resort is a liver transplant, but you don't want those problems. That needle is like 6 inches long, and when I say the needle, it's called periocentesis, and this is when the liver stops functioning. We start to have excess buildup of fluid on certain body parts like the abdomen, the gonads, the legs, the heart, the lungs. And so they have to take this long 6-inch needle and stick it down inside of you to withdraw that quite frequently. It's not just a one-time thing. You're going to continue over a period of years to have this same procedure done over and over and over again, because your liver is not functioning the way that it's supposed to. And so you have a buildup of ammonia and all the negative chemicals and stuff that's in your body. And if you're continuing to drink, it's just going to get worse and worse faster. And eventually your liver is going to shut down. And I watched my father die of this. And it is a very slow and agonizing and painful death. And I don't wish it on my worst enemy. It's not good. Eventually they start to lose their cognition, and then they fall asleep and they don't wake up. I've heard people say that alcohol actually makes them sleep better. And this is true. Alcohol does make you fall asleep faster and sleep more soundly during the first half of the night, but alcohol actually disrupts the normal sleep cycle. And so even though you are falling asleep more quickly and sleeping more deeply during that first half of the night, you're going to experience more insomnia and restless sleep in the second half of the night, which is your REM sleep. And that's where we have the repair and the restorative work that the body does during the sleep. So people who drink heavily often appear to be at increased risk for sleep apnea, and that's going to be especially if they snore. And sleep apnea is a condition where the upper air passage is going to narrow or close during sleep, and that's going to result in a lack of oxygen to the brain. And that's the same thing that happens with a stroke. You have the lack of oxygen to the brain, it's going to cause brain damage. And in particular, drinking at night actually leads to a narrowing of that air passage, and it's going to cause episodes of sleep apnea. And alcohol's depressant effects, when I say depressed, I don't mean like sad. That's not what I mean. Depress means to reduce. So it's going to reduce the functioning of the central nervous system. And that's your heart, your lungs, your respiratory, things like that. And so the depressant effects of alcohol are going to increase the duration of periods of apnea as well. So you're slowing down your heart rate, you're slowing down your breathing, and then the apnea on top of that is with the constricted airways, so you're not getting enough oxygen. And then, the combination of the alcohol, the sleep apnea, and the snoring is going to increase your risk for heart attack, arrhythmia, stroke, and sudden death in your sleep. So the question that I have for you is, have you known, or has anyone that you've known, or have you had any of these physical problems that sound similar to the ones that I've listed here?